Good morning, good morning, good morning. Welcome to another episode of Untomato, Words of Wisdom that I share with you to add to your repertoire. What a wonderful day we're having in Atlanta. I don't know where you are, wherever you are. I hope your day is as precious as mine. And I hope that you are surrounded by love and beauty, the joy of living, the joy and love of family. How can you ask for anything better than that? I'm certainly enjoying my day. Today's topic is a very disturbing one because it's going on so many years. It's been going on and no solution, no real solution has been achieved to alleviate the problem. This topic is essentially a critical matter for women to pay very close attention to. If you are an expectant mother or a husband of one, perhaps a family member or a friend, or even a future mom, you truly need to pay attention to this program today. You know, there's been numerous analyses and researches that show that at hospitals that disproportionately serve Black mothers, women are at a higher risk of harm during delivery. It's been long established that Black women fare worse in pregnancy and childbirth, dying at a rate more than triple that of white mothers. The disparity can be attributed to so many things, to such factors like poverty, and of course, limited access to quality of health care. Many individuals, many women who live in, who are poor, if I may use that expression. I really hate to use that word, but when they're poor, they don't have access to quality health care. But recently, there is growing evidence that points to the quality of care at hospitals where a significant number of Black women deliver, often in communities negatively affected by segregation. That is very important, so that if you are a woman and you're getting ready to give birth, pay attention to what hospital you're going to. Pay attention, do your research. It's imperative before you even go to a hospital to give birth. Do your research about that hospital. It's in the open. You can find out what is the percentage of women of color who make it out of childbirth safely. Think about that before you go into any of these hospitals. Now, researchers note that at these so-called Black serving hospitals, and that is because there are some hospitals that serve predominantly minority women, Black women, there are serious complications such as infections, birth-related embolism, emergency hysterectomies happen far frequently than it does in any other kind of hospital that serves more Caucasians. This is an important thing that you need to know. Where they deliver most Black babies, there's a tendency for a higher number of women to die in childbirth or lose their children. So that's very important. And that's why I say to women, please, this show is about you paying attention. If you know somebody who is expecting and perhaps is not paying attention to such a thing, then it is imperative that they are on this show. If they're not on this show, share this video. This video is very critical. You need to know what's going on in the world of Black women trying to make deliveries. Joining me in this discussion today is my guest, Dr. Simona Ajamu, the president of Intuitive Sciences and a commissioner of the African Women Mobilization Commission, OMC. Dr. Simone has researched this phenomenon in Black community and is sounding the alarm bells. It is my pleasure to welcome, as always, to the show, Dr. Simona Ajamu. How are you?
Very good. Very good.
You look lovely this morning.
Thank you. You just know.
It's good to see you. Thank you very much. I'm trying to keep up with the times, you know. I'm trying to age gracefully. You know what I'm saying?
You always look wonderful. You always look wonderful.
I'm trying to keep up with you, my sister. Trying to keep up with you. So I just want to get into this. Now, this is something, Dr. Simona, that I read that's quite shocking. And that is that across 3 states in particular, about 1 in 10 hospitals in the analysis by ProPublica was Black serving. In other words, these incidences are happening more extremely in these hospitals that serve Black people. 99% of the mothers who give birth at Jackson Park Hospital and Medical Center in Chicago were all Black. Now, here's the thing. These deaths are not necessarily focused or concentrated amongst Black poor. There are rich Black women that go through the same thing. Take, for instance, tennis legend Serena Williams.
Yes.
She's widely regarded as one of the greatest athletes on the planet and perhaps ever, you know. But she recently gave, well, I think her daughter is about 4 years old. So about 4 or 5 years ago, she was profiled on Vogue, where she talked about the fact that she almost lost her life giving birth to her daughter. And her harrowing experience serves as a high profile microcosm of the racial inequities which still haunt the American medical system. So it's not about you being poor, it's not about you being rich, it's about you being Black. I hate to say that. And there's another woman, Jennifer Carroll Foy, who's a public defender and a mother of twins. She ran for the governorship of Virginia last year. She shared with Elle magazine her own experience, her pregnancy story, and it was harrowing. She almost died after giving birth to her twins, as is the case, like I indicated earlier, for many Black women. White doctors and nurses downplayed and dismissed her excruciating postpartum pain. She says that Black women in Virginia are 4 times more likely to die during childbirth and postpartum because we are not seen, she said, because we are not heard.
Yes.
We are not believed.
Yes.
She says that it's costing Black and brown women lives because these doctors are not paying attention. There's so many stories of Black women almost dying or dying during childbirth at these hospitals. So, but I will share this before I bring. I ask for your input. It's also an international phenomenon with Black women. Some of the lives are not valued.
Yes.
The lives are just not valued. Just recently, a few years back, I was in Nairobi, Kenya. And while there, we were taken to the hospitals where women delivered birth. And we were in this room. It was frightening because the room had, most of the women were on the floor giving birth. And only one nurse was available. So some of them had breech births. You can imagine trying to birth a child has been, and very limited, if any, care, was being given to them. There was blood everywhere. I couldn't take it. I had to leave that room. I couldn't believe what I was seeing. And of course, the nurse was overwhelmed. She said there were no doctors. And she was, what did we expect her to do? Because we were throwing questions at her. How can this be? Who's helping these women? There were no doctors. So it's not just something that's happening here. That lack of care also happens on the continent too, in some hospitals. So I want to ask you, Dr. Simone, what personal experience you've been doing research in this area, and you have a personal experience to share that solidified the problem for you. Can you share that with us? What happened to you during childbirth that has made this a passion for you?
Now, 2 things happen. I have a now 7-year-old and I have a 4-year-old. When I was delivering my 7-year-old, the first incident that happened was without any, when they do an epidural, I was getting an epidural, and when they do an epidural, they're supposed to numb the area so that you can't feel. It's a very pretty big needle that goes into your back. Mm-hmm. So what happened is they allow one person, in the room to assist, which was my husband, and my aunt was there, but she had to, and she's an RN, and she had to stand outside of the door. Mm. And so, it was maybe like 2 nurses there. And what I didn't know is they slipped in an intern, without my permission. They didn't say, okay, we're going to have an intern do this. And so this intern, she didn't allow the the numbing agent to work. Numb that area. She didn't numb that area. She forgot that step, I guess. And she began to stab me. She stabbed me 12 times. I had the scars on my back of where she stabbed me 12 times. And it was sore to the touch for 2 years. If I just touched the area, it was sore there. When I left, I could barely pick up my baby. I could barely walk. I could barely go up my stairs. It was horrible. It was a nightmare. And when she was stabbing me, you can just imagine that's the worst type of attack. It was like an attack. I'm screaming at the top of my lungs, and she's going, one, taking it out and putting it in, just stabbing me one, repeatedly, and I'm screaming. And then when my aunt came in, she said, well, the nurse out there said she just can't take pain. She just can't handle pain. And it had nothing to do with that, you know. And so, I wonder if I would have been another race, how that would have, if there would have been a little bit more compassion for what I was going through. Unfortunately, the doctor that I had was not there because his nephew had committed suicide. He had to leave. And so when he came back, I never saw a doctor cuss, but he knew something was wrong. He was cussing out, cursing the nurses out. He was really angry when he seen what had transpired. And so, but they tried to cover it up. It was just a cover up. And then not only that, she put the epidural in, but not in the right spot. So I end up not only being injured, but having to go through a natural labor and delivery, which my birthing plan was to have the epidural to assist me with that. So it was it was just a nightmare. But for someone to say, a white nurse to say, oh, she just can't take pain. And you didn't even try to check out what was going on. Why would I be screaming from the top of my lungs? I had a baby before. I have another daughter prior to that. Why would I? In that, it's supposed to be just a pinch from when they put in the the pain, the numbing agent, and feel like a bee sting. That's the level of pain that they said this should be. So if I'm screaming at the top of my lungs, the whole, people are, when I start screaming, the other nurses, the other staff start coming in to see what was going on. And then you say, okay, she just can't take pain. Instead of saying, okay, let me see what's going on with her. But that doesn't stop there. That was at Henry One Hospital. Maybe I shouldn't mention their name. That was at one hospital. Then when I went into labor and delivery with my other daughter, it was at another hospital. So I went to another hospital. I was in labor, but my doctor didn't feel that my labor was active enough. And so she said, well, you can stay or you can go home and come back. I said, well, I'll just stay. She said, well, you wait, in this room. And then when things change, have the nurse give me a call. The nurse will give me a call and I'll come and we'll send you to labor and delivery. Well, this nurse, it was the middle of the night. And this nurse, I started going into active labor. And I told the nurse, can you call my doctor? She said, I'm not calling your doctor because you're not in pain and you're not in labor. I asked to speak to the supervisor. The supervisor said that she wouldn't call my doctor. I said, I feel the baby pounding on my pelvis. I've had babies before. It feels like she's going to come out at any time. They refused to call my doctor. My doctor did not get called until the next shift when the other doctor came in. I'm hysterical. Oh, and God. He puts the phone to my doctor to my ear, and I'm talking to her. She knows my personality. I'm a very laid back person. She's like, what is going on? I said, they would not call you. They would not call you. They refuse to call you. And I've been in excruciating pain. It feels like the baby is going to come at any time, which when they got me in labor to delivery, less than an hour, the baby came. And guess what? She had the umbilical cord tied around her neck. Oh my goodness. So if I would have delivered her in that room, she could have died and I could have hemorrhaged to death. But That nurse, she was a white nurse, and she had no, she just left me in there, and she said, you know, she said, "You're not in pain and you're not in labor." I'm in full labor where I was contracting less than a minute apart. It was like a half a minute apart. I'm contracting, couldn't hardly could, just taking my breath to breathe. And I'm telling her, I said, this baby is coming. I could feel the baby coming.
Mm.
And that could have been it was so traumatic for me. I have a 2-year-old now. And my doctor, she was a wonderful doctor. But, this time she had to make all of these provisions for me when I had my 2-year-old to make sure this would never happen. Every visit I told her, I said, I do not want that to happen again. She put everything in place, and she made sure if she feels a little bit of pain, you guys better, if I'm not there, because sometimes the doctor, depending on the shifts, they may not be there. You better let me know what is going on. They sent me straight to labor and delivery. I didn't have any problems or anything like that from that time. But it was so traumatic.
Yeah.
It was a very traumatic experience. And I'm not the only one. A lot of women, Black women, are going through that.
Let me share, Brooke Berlin indicated that she went through the same thing with her mother. These doctors really don't care. They told her that you're not having this baby, but she was almost there already. That's the same thing that happened to me with my daughter, Adora, and I was in labor for 23 hours of hardcore labor, and it did nothing for me. Nothing for me. I was dilated 3 centimeters, and Adora was already ready to come. But they just, if I'm not dilating, something must happen. Fortunately for me, my husband was such that, he was very demanding. There were other things involved, but I don't want to go into that. It's too personal. But he's the one who told them that he was going to sue them if they did not have a C-section right now and get the baby out, because this woman is going through some serious trauma. Sent 3 cm, and that baby's coming out. Now, just like you, I could have hemorrhaged to death, and she could have died. When my daughter was born, her head was shaped so like a cone. I was staring. I said, oh my God, what is this? What's wrong with her head? That's the trauma she had gone through. She was traumatized in the womb, and they did nothing. And this was supposed to be a good hospital. So yes, these things are happening. And we African mothers, we need to be aware. Now, if you're, it doesn't matter your race, if you're in a hospital that's serving predominantly African American and people of color, it will affect you. I don't care if you're white or not, because it's in that hospital. That is those are who they serve. Now, if you happen to be there, oh well, they throw you right in there with everybody else. But we need to be aware. Now, let me share this with you also. One of the, in addition to losing their babies, one of the biggest studies shows that the hemorrhage is the hemorrhaging that's killing a lot of them, disproportionately Black women in these hospitals that serve them. They come up with severe complications, hysterectomies that are not necessary ordinarily, but they have to be done, and they're all directed. When you start to hemorrhage, then what they do is they do a hysterectomy. So, because it's directly related to hemorrhage. Okay. They have pulmonary embolisms that happens a lot in these hospitals, and all of them are all correlated. So, as you indicated earlier, it's almost like they don't see us as human, or they think we have supernatural powers. We can take all this pain. It doesn't matter. So when we start to scream and yell, they look at you like, oh, well, it's going, you're not the only one. This is done all the time. Women have babies all the time, so there's nothing, no big deal that you're going through this, So, but my question to you now is, it does happen. We know it does happen. These are challenges that Black mothers face. The studies have been done, but what is being done? I mean, obviously the numbers are not going down. What are some of the ideas that you think that we as Black mothers should be, or pregnant mothers should be looking into, paying attention to?
I feel that, for one, we have to understand that this is a crisis in
It is.
our community for Black women.
Mhm.
And you have to understand it has nothing to do with education, it has
Mhm.
nothing to do with how much money you have. It
Mhm.
is the fact that you're Black. And
Yes.
the federal government, in my research, the federal government has put aside money, and they're creating policies to try to help with this, but there's not enough help because it's still happening. Detroit,
Yes.
Michigan is 79% Black, but there's a 4.5%. I mean, 4 point Black women are 4.5 times more likely than white women to die during birthing. And so that is an issue. And no matter where you're at, because Oregon, with researching the different places, it's national. It's even went to the United Nations. This has been
Mhm.
going on. It's just a crisis. And you as a Black mother have to understand, and your family have to understand, that when you go in there to birth your child,
That's right.
you may not come out because of, and the government, the United States government, the federal government has acknowledged that this is due to racism and implicit bias.
That's right.
Women are dying not because, we're not talking because of the things like women have diabetes or they're at risk. We're not talking about that portion of people. The research that I did is on women that were healthy, or if they did have a condition, it was preventable. It was totally preventable. All of the mortalities, and they talk about the mortalities. If you go onto the CDC website and put in Black maternal mortality, they will show you the numbers. 4.5 times higher than a white woman. Black. And I know other races of women, women of color are affected. Black women are the
Yes.
leading. They're the ones that are literally dying, that this is dangerous for. A Black woman, a white woman with an 8th grade education, I read this statistic, has a better chance of surviving childbirthing than a Black woman with a master's degree.
Wow.
So this is not, has to do with education. It has nothing to do with any of that. Our lives as Black women are not valued, just like a lot of the lives of Black men are not valued, and police are killing them in the streets. Well,
Mhm.
they're killing us in the hospitals. And my thing is this: there needs to be more consequences for these actions. If you are responsible for for a Black woman dying of a preventable for preventable causes, and not only the Black women, their children, the infants are dying too.
That's right.
The infants are dying. So if it may be the mother and the baby, and sometimes it's just the infants. If you go on YouTube, there is, you put Black maternal mortalities.
Mhm.
You put that into YouTube, and you will see TED Talks. You'll see all of these videos of these people talking about how, the mortalities and disparities that has happened to them and their families. Judge Hatchett's daughter had a C-section. She began to have complications. Her husband said, can something's going on with her.
Mhm.
They waited 7 hours. He said he didn't want to push the envelope because he didn't want to seem like the angry Black man.
Mm-mm.
And my thing is this: do not stop. This
Push the envelope.
and
Push
that.
it already.
Do not stop. Do not, just like Auntie, Your Excellency husband. Thank God,
Yes.
or whatever you believe, the universe, that he was not thinking like this. He
Yes.
knew the sense of urgency, because Your Excellency would not be here, nor
That's,
her daughter would be here.
that's right.
We have to start supporting our families You
Yes.
know, Black women, and I say women, it's a communal thing. It's not just Black women, but we have to start supporting each other,
That's right.
supporting this cause, and standing up for the lives of Black women and these children.
That's right.
Now,
It happened. It happened to Adora. What happened to me
yes,
happened to her too.
yes,
You see what I'm saying? So it's,
yes,
she said when she was having her first son, she found out that she could have a natural delivery, but the doctor refused to do more than just give her Pectocin after failure to dilate at 5 cm. So they had to have a C-section. So sometimes you have these C-sections that are not necessary, right?
yes,
They make money from that. So immediately they go for that. Or they just ignore you completely. Brooke Baxter says it's racism. Of course it's racism. That's what it is. It's the color of your skin. That's what determines if you live or not. She says that she works at a doctor's office. And so she knows that what we're saying is true. Okay, she's a white woman. She's been there.
yes,
She worked at a hospital, a doctor's office, when she actually saw what we're talking about. So it's not just black women talking. No, she saw that. She saw that. It's about money. It's all about money. And you're right. Husbands, family members, don't just send your wife to the hospital and wait until they come and tell you, oh, she's delivered. No, 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 no. You better be in there. Be in there and observe and make sure that your wife comes out of it. You don't need to raise your baby by yourself. That baby needs her mother or his mother, and that baby needs to come out healthy and safe. So,
yes,
so we need to not, I mean, matter of fact, it's almost a mandate that people should not go to the hospital without having one of their own standing right there making sure that what's being done is done. Scream and yell if you have to. I don't care if they call you an angry black woman or angry white black man. Anger is relative. People are angry because something is happening. They just don't get angry for nothing. You understand what I'm saying? So you be there
yes,
and you yell and scream if you have to. Now, they have you and I talked about doulas.
yes.
Okay, importance of ensuring that doulas are available, particularly in low income. So low income black mothers will have someone advocating for them. Talk to us about that.
Well, the doulas, even this is such a problem that even major corporations are getting on board with trying to solve this problem. Like Dove Corporation. Dove
Uh-huh.
Corporation gives $1,300. You don't have to have a income requirement for that because they know this is something that doesn't have to do with an income, but as far as income goes, but that is available, that they have allocated funds to it's called the Black Maternal Equity Fund or something like that. But the thing is, the doulas are there to somewhat advocate for you, to have a certain level of knowledge that if something is going wrong, they're able to get you help. Because if the doctor or nurse is not listening to you, then the doula is there in order for them to give you that support. So hopefully they can save your life if the
Mhm.
doctor is simply you're sitting there hemorrhaging to death or something is going on with the baby and the doula can step in and intervene and advocate for you. But not only do we need that with hiring doulas, the people that are supporting you, if that is a partner, if that is a husband or whoever will be in there, mother or whoever is going to be there supporting you, also needs to know what to do, what to watch for, what doesn't look, if something doesn't look right.
Mhm.
And we need to, what do you do? We
That's right.
need to start a coalition just like Black Lives Matter. And what my vision is, and UPSI also coming on board, is that we create a coalition of people
Yes.
that we train, that they have a knowledge of they have numbers to several hospitals in their areas,
Mhm.
what numbers the hospital administration, if they're there in the middle of the night, like me, I knew I could call the hospital administration in the day, but they were closed at night. I didn't have the number, nor did my husband have the number to who to call for help. We have to have all of that. So, we need to come together and, as a community, it's all of us. Black women dying is all women dying. We have to understand that, so we have to create something that if that mother is in there and she's because you're in such a vulnerable state in the middle of labor and something's wrong, that she can call someone, one of her, a sister or a brother or someone, to help and be able to work on the outside to be able to get the help that they need.
But particularly those who don't have any support. There are people who don't have family,
Yes.
but they go into labor and there's nobody there with them. But if they had a doula who's
Yes.
available, they have a number, they can call that doula and say, hey, I'm on my way to the hospital. And maybe,
Yes.
and the other thing is that, I don't know if they actually did it, but Jennifer Carroll Foyle, the woman who ran for governorship of Virginia, she had advocated that Medicaid should cover, doulas.
Now, in certain states, there is, I believe, I can't remember what states, there is, because of this is, people don't understand how serious this is. Okay. In certain states, I researched, and they are Medicaid and Medicaid pays for doulas in certain states. There's not a lot, but certain states they're paying for doulas. Here in Michigan, I'm in Michigan. Here in Michigan, in October, they've already put it en route to pay for Medicaid. That Medicaid will pay for doulas. The Department of Health and Human Services just has to get it approved. Okay. So not only do we need the funding for the doulas, but if anyone is interested in becoming a doula,
that's right.
Take into account, this is something that you can do, and the state will be paying. And I don't see why they wouldn't go through with it. It's too much research. It's too much. Many Black women dying.
It's too much of a need. It's too much of a need. Yes.
October of this year, Michigan will make that final decision to add that to the Medicaid for Medicaid beneficiaries. Other states, like I said, other states, I can't remember exactly which states. I know certain states are getting more for this particular problem, more assistance through their state. Like the state of California is giving more assistance to Black women, and I believe they are providing some type of funds for doulas and things like that I was reading. But we need this all over the United States of America because it's happening everywhere. I couldn't believe Oregon, Iowa. I mean, how many Black people are there, and you're still killing,
honestly,
still dying. There's hardly any, how many the Black women population there, in areas that there is not even a high population of Black women, so this is something that, for one, there needs to be support, like you said, with the doulas, and there needs to be consequences. These hospitals needs to take accountability, and there needs to be some type of prosecution for this. People will stop if they know that they may have to go to jail if they don't take this seriously.
You remember historically, this is not necessarily about women, pregnant women, but remember there was a time where they used Black women. They did surgeries and all those things without giving them any pain, medication. And so that's continuing in a different form now with the childbirth. When you're screaming and yelling, it's like last time, hey, they did surgeries on Black women, cutting their skin and all of that, cutting into them without giving them anything to help them with pain. Well, one of the things I'm excited that you and I have talked about is how we are going to collaborate to begin the training of doulas, okay? And it entails a whole lot of things, and we're going to get into that as soon as the collaboration takes place. But we see the need See, I tell you one thing, you can't talk about what people are doing to you if you allow it to be done.
Yes.
You can complain all you want, but are you prepared to do something about it? You know, you can do it. We can do it. We don't need other people to do it for us. We can do it. And that's one of the things that I always complain about, you know, when we talk about what they're not doing for they who. They who? You. You are the solution you're looking for. So we have a responsibility, and that is what UMSI and Dr. Simona Monet, we're going to be working together with her company, Intuitive Sciences, to come together and make this part of an essential and critical program. It is a critical program. Now, I remember when we used to have a lot of, when HIV/AIDS, one of my other companies, when HIV/AIDS was, you know, very prevalent, and they didn't really have much information about it. We had a lot of workshops and conferences to talk to people about, you know, the dangers of HIV/AIDS and how to protect themselves and all that sort of thing. And it was absolutely supported, you know. And I can see that for this one, we need to have such conferences. It's critical. I think it's a critical conference to have and bring, you know, right there, you can actually register the doulas. You see what I'm saying?
Yes.
When people come and understand how important, like Brooke Berlin is saying, hey, she wants to be a doula, you know.
Yes.
Yes. So it's not far-fetched for us to run that program, you know. So I'm excited that we're talking about it, and we're going to be doing something, because I don't believe in talking about things that are difficult things happening and we can't do anything about it. I want to throw this in. Just recently, 2 days ago, a young 26-year-old, beautiful, you saw the picture, young bride, the daughter of Zainab Ahmed, who is the co-director for UMSI in Nigeria. This gorgeous child has no mother, no father. So she took her son, married this beautiful girl, and she saw this girl as her daughter, right? So she was excited about this new daughter, gorgeous daughter that she has. And then worse yet, not worse yet, it is worse now, but at that time, 3 days ago, this woman was pregnant, 8 months pregnant. So you can imagine the joy for the husband and the mother-in-law. And just that quickly, she got sick, something minor really, but she died just like that. And the heartbreak is that Zainab tried to tell them why the baby was still alive, to do surgery, C-section, save the child. They didn't want to do that. The child was still alive, even though the mother was not breathing. But, you know, the child doesn't die automatically like that. But, you know, there was still a few moments that they could have just done C-section and saved that child's life. But they just said they had no electricity. Nonchalantly, just like that, this beautiful woman was put in the morgue with her baby. So these things are happening, you know, the lack of care, you know, lack of concern. It's not just an American phenomenon or British, or it's an African phenomenon as well. So work needs to be done there. We are going to have to train some doulas over there, so that when women go into, you know, have problems, complications, there's somebody to advocate for them, you see. And there are some other ideas that, you know, a lot of, because in some cases doulas are not paid for, you know, the poor women can't afford them. So they have to pay for medication, prescription drugs, you know, overpaying for something that will help them, you know, because it's not covered by Medicaid in some areas. So they have to choose buying life-saving medication, you know, over paying their rent. So the money that could use to pay for prescriptions or to pay for getting a doula or anything like that, they can't afford it, you know, because they have to pay rent, they have to pay groceries. So those critical things that they need, they can't afford. So to make this affordable will be to cover it by Medicaid. And of course,
Yes.
reduce the cost of prescription drugs, which is so high, you know, so these women will have a little money to work with, But my advocacy is let Medicaid cover it. It's an essential work that needs
Yes.
to be done. So let it cover it, so women don't have to worry about, oh, do I have to pay my doula, or what? It's such a difficult thing, and I think that is one of the critical things that need to be done, and that is to lower the cost of prescription drugs and helping these women by making a payment for the doulas, a Medicaid funded payment. And you talked about earlier that racial bias is 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 part of the reason why this is happening.
Yes.
Part of the reason, it's part of it. But think about this: these professionals need to be trained.
Yes.
They need to be trained about racial bias. Some of them don't see it. They don't even, it becomes so second nature to them. It's just life. It is what it is. They don't even understand what role they're playing, that their own prejudices is impacting the death of these people. If you see a black woman as not tolerant, like the lady said to you, oh, you can't tolerate pain. Well, when you're in trouble, they're not going to do anything for you. But a doctor needs to know that no, a black woman is no different from a white woman. If she's in pain, she's in pain. It's not innate in her to tolerate pain. When you pinch me, I scream. So my
Yes.
labor pains is the same thing as the labor pains of a white woman. You can't assume that what my screaming is irrelevant and it's not important because you think I can tolerate pain. Who told you that? It's racial bias. So training these medical professionals must be an imperative. And also,
Yes.
the medical schools really should have an increase in diversity. There should be a whole lot more black people in gynecology and all of that. It's so critical. We need to be present. We need to be a part of it. Okay, what do you think about that? About medical training for
I
by
think that I
medical.
think the medical training is essential. They've already started like implicit bias training. To me, honestly, I think it's a joke because it doesn't, literally they're going through these trainings. And if they have these prejudices or if they're racist and they don't want to change who they are, how they view Black women, they're not going to do it. That's why I feel that there should be consequences.
Consequences. That's right.
And that is where, and I think that with us working it together, us collaborating with some of the other groups that are out there, like
Out
Black
there,
Mamas
yes,
Matter, they're fighting. They have policy. They're fighting for policy change. But
yes,
one thing that they will do, I know I work for in civil services with the Michigan Department of Health and Human Services, and under the Michigan Department of Health and Human Services is Child Protective Services. And one thing that happens, there was something that happened where a child died. And when that child died, guess what?
what?
Those social workers they were trying to put in jail, they were accountable for that child dying because they said, well, you did not go. You knew that parent was not fit. You said that you went over there and you did not go over there. So it caused a mortality with that child that could have been prevented. But guess what? They had to go to jail.
Mm-hmm.
But how about we do those type of consequences in the hospitals? If the mother several times have told you something's wrong, I'm in
Yes,
pain, there is
yes,
something that's going on, and
yes.
everyone ignored her that was on that shift, leading up to her dying,
That's right.
they need to go to jail.
Mm-hmm.
The consequence is that you go to jail.
That's right.
That is a crime.
That's right.
Just because if it was white women that were dying at the rate we were dying, they would have something like that in place, I guarantee you.
That's right.
But for so long, our life has not been valued. Another statistic that I researched was Black women, and during slavery, there was a better chance that you would survive birthing with none of the technology that we have than now. The rates of survival for the child and the mother was higher in slavery. But why? Because we were property. You have to
Mhm.
understand at one time we were considered property.
That's right.
And because we were property, you are not going to let your property die. Is like if you have a cow or you have, and that's how they looked at us. That's how we were looked at one time. If you have you have cattle or whatever, you're not going to let that, those animals die because that's money. At one time, we had a monetary value. So
Hmm.
now that we don't have slavery, there is no monetary value anymore.
Hmm.
It has become, that we don't have the value, and you have so many people that feel that way. And it's unfortunate. Not everyone feels that way, but it's unfortunate. But like I said, there needs to be consequences. There is not enough consequences. A training after you pretty much murdered because you didn't listen to the lady and she hemorrhaged to death. It's not, that's what is that doing? What is that doing? Because obviously it's not working, because still Black women are dying in the hospitals. And not only Black women, I'll say women of color, but we're the lead in
Yes.
this. So the value of our life, what it's saying is our lives are not valued. So in order to change that, I don't think change will come until there is strict consequences. Yes, we should have the training, but in that training, people have to know, okay, if you allow another Black woman to die from a preventable cause, or
Hmm.
that infant, that you are going to jail. There needs to be protocols in place.
That's right. That's right. And here's another idea. And this woman, Jennifer Carroll Foy, she really pushed for that. Unfortunately, she did not win the governorship, but she pushed for this notion that we should have mobile health clinics to serve the state's rural communities, because a lot of those people in the rural areas are just totally ignored, you know. So you can imagine the death rate there, talk about that. What do you think?
I think definitely there needs to be mobile clinics in rural areas. We need more money, just women in a whole. It's never been a priority, for women in healthcare.
Hmm.
But we need to mobile clinics. I feel that is an excellent idea for rural areas where you can't really get to the hospital,
Hmm.
and having that support, doulas, midwives, people that are able to support and be able to get that woman to the hospital if needed, or to some type of level of care. And then what you touched on, even, outside of the United States, we need to be supporting different places where the mortality rate is up because of things like they live in a rural area.
Hmm.
Like in Africa, I believe I was watching a documentary, some time ago, and they were saying how women were dying because they couldn't get to the hospitals, during childbirthing. So this is something, it's not just here in America. We're going through the crisis here in America. Also, I did research Europe. It's not as bad as here. They're doing similar things in Europe. Mortalities are happening during with maternal women in Europe, but other places around the world, it has to be maternal protection, in areas that, for women that are not protected, and we're having these mortalities, we're having these disparities because we can do something about it.
Yes, we can, and we must. Yes,
Yes.
we can, and we must. Oftentimes, many of us sit back and wait for somebody else to do it, but nobody's. We are that change that we're looking for. We need to, like you were doing research, I was doing my research. We need to be part of the solution. You
Yes.
can't keep complaining about what's happening. Somebody indicated that, population control, so some people think, oh, that's just talk, but you don't know. But
Yeah.
whatever the reasons why these things are happening, our role is not to sit back and fuss about it. Our role is to ask, what do we do? And again, I want to reiterate that we are excited about the possibility of starting to train doulas. We've talked about
Yes.
it, and there's funding for it, and we're going to go for it. We're going to go for it here in the United States and also in Africa. I
Yeah.
had a meeting with a group of women who are so excited about training to become doulas. Of course, they would like, they know, they understand that this is happening. It's happened to them. They see it happening to others. And whatever it is that they can do to be of support, they're willing to do it. So it's an exciting program as far as I'm concerned. Go ahead.
And Your Excellency, another thing is we have to get back to, we're in a modern time. One of the things that we have to get back, and that's why it's so important. If someone is out there and they're considering being a doula, please do that, because we have lost a lot of the knowledge that our ancestors had as far as birthing children. And they had a lot of knowledge, and the babies came that was safe and the mothers were safe. So not just counting on the hospitals to have all of that knowledge, having some knowledge ourselves, and supporting our loved ones that are going in there into the hospitals, to have children. Supporting, if you have to take shifts, maybe auntie comes at one time and mom comes at another time,
Yes.
and dad is there, and the cousin comes, and you're just checking on her. You're calling whoever is there to support, to make sure that things are going right. You need a team.
Mm-hmm.
We need to team up, have our families team up, and we need to be learning, even if it's just for that loved one that you have. At least having it, if you say, well, I don't want to be a doula for all of these women, but I do want to gain the knowledge to be able to support and protect my loved one. And I'm talking to the fathers too.
Yes, the fathers need to
You know,
know. The
so
fathers need to know. It's not about you. I said, in the movies they talk about, oh, you take your cigars and all
right,
these,
right.
you're excited that your wife just had a baby. Having a baby, for God's sake, is traumatic enough.
Yes.
Okay,
Yes.
but to go through that hell, excuse the expression, and
Mm-hmm.
nobody's helping you, or because when you're going through the labor, you're not focused on all the extra things going around. You are actually depending, on other people to do the extra while you're doing the work of pushing that baby out. You understand?
Yes.
So if there are complications, there's somebody there that says, okay, this is not working. We must do this. We must do that. Don't ever assume that these doctors, that they're there for you. And it's the same thing. It's a little bit a different argument, but it's the same thing for the elders. Some of these doctors, unless they're gerontologists, they really don't care about the elderly.
Yes. Mm-hmm.
You can go there and they just give you pills. Pill this,
Yes.
pill this, pill this. You've got to advocate for yourself, or that pill will kill you.
Mm-hmm.
You go in there with a headache, you come out with all kinds of damage to your organs because of all the nonsense they give you, because they don't think you're worth the time as an elderly person. So it's the same thing, Don't, I say, if indeed there's if indeed, and that's an assumption. I'm not saying that it's anything that's written that's real. It could be that it's a part of population control. Well, be your own advocate. Don't be part of that control. You know what I'm saying? Make sure
Mm-hmm.
you're here. Make sure your child comes in. Make sure your wife lives. Make sure your daughter, your sister-in-law, whomsoever, survives the nightmare of childbirth. Childbirth is not a joke. When a woman is telling you about childbirth, if you men can do it, right, you will be able to do it too.
Yes.
So when your wife is there screaming, don't think it's just, oh, well, it's part of childbirth. That thing is, excuse the expression, I hate to use it, hell.
Yes.
It's not easy. So you're an advocate, not there to carry a cigar to celebrate the birth. Make sure she's safe, that she comes out safely and the child comes out safely. Then you can light your cigar. We don't stand in the hallway and wait for the doctor to come out and say, well, she made it through. And then you light your cigar. No, you better be in there. Complications may happen that you can save her life. Go ahead.
And there was another story that I saw that was also on YouTube. Like I said, I encourage everyone to put in Black maternal mortality in YouTube, and you'll see all of those things. The father's talking. This particular young father, he had his partner. She already knew. I think this was in New York. She already was having issues with the medical staff. It was during COVID. And she was telling them that, things were wrong. They were ignoring her. So when she went into the hospital, she said, I hope this goes okay. Well, it didn't. She died. She died. They let her die. And he didn't speak up. We have to, because men a lot of times are a part of this. We have to encourage our men, because I know society, especially with Black men, has really made it where you're scared to speak up.
That's
right.
But
you have to speak up.
You have
and to. I believe, just like your husband, your excellency, maybe he will be a good advocate. I mean, a good person to come in and talk to the man about, hey, you speak up like I did, because that would have been my wife's life.
That's right.
And if the baby would have survived, I would be, widowed and have to take care of this child myself. And the child is asking, where is my mom? I'm watching these stories. If you go on YouTube, you'll see these stories, and they're heart-wrenching.
They're heart-wrenching. I want to add this, answer this question for Brooke Berlin Baxter. She wanted to know is if schooling is expensive, are the grants so people who can't afford it can get free discounted training? Imagine if we could educate, give these women purpose and a way to thrive. Yes. We were just talking about the fact that there are some grants available here, so that if you want to actually be a doula, just contact us. I've been sharing how to contact us, and we've come to the end of our show. But I want to add, just to remind all of you to please take the time and go to our YouTube and join, subscribe. It's so important that we show that we have individuals watching our program. We're doing everything that we can to make sure that you enjoy our program. So I ask you to join me on YouTube, on our YouTube channel, and subscribe. If you haven't done so already, please subscribe. It's very important that you do that. This is an important show, and we try to bring people like Dr. Simona Monet to come and talk to you, and individuals from the community. It's always important that you support us so that we can support you as well, by making sure that we're bringing more and more individuals that will help to share knowledge that you can use and add to your repertoire. Thank you very much, all of you, for joining us today. Thank you, Dr. Simona Monet. And thank God that you and I survived the nightmare of birthing. And we want the same thing for many, many other women. And all of you who joined us on Ntomodu Show on YouTube, on Ntomodu Show on Facebook, thank you for joining us. Again, we're looking forward to a very, very exciting program next Saturday. And we hope that you will join us. Again, life is not guaranteed to anyone. It is your responsibility to make sure that you continue to be a part of this thing called life. If you can't do for yourself, then nobody can do for you. Also, be your sister's keeper, and make sure that she is safe. If she doesn't know it, make sure that you make sure she knows it, what to do and what not to do. Thank you so very much. This has been the Ntomodu Show, and we look forward to seeing all of you again next time. Good day.